Nurses have been front and center throughout this pandemic, and for some time now, whether on social media or from organizations that represent nurses, one word keeps coming up: crisis. Last month, Ontario announced a pathway for more internationally educated nurses to qualify to work here. With us now for a closer look from the nation's capital, Amina Silva, an internationally educated nurse from Brazil who just became a registered nurse in Canada this year. In Markham, Ontario, Carla Ducusin, an internationally educated nurse from the Philippines who has also practiced in Jerusalem. She came to Canada through the caregiving pathway and has been working as a caregiver. And in the provincial capital, Birgit Umagba, an emergency room and intensive care unit registered nurse who is also a clinical practice instructor. Welcome to the program to you all.
Thank you very much.
All right, so Birgit, I'm going to start with you. You have been an advocate for nurses and a vocal advocate for nurses here in Ontario. I want to read an excerpt from an opinion piece you wrote for the Toronto Star titled, "Nursing Shortage, There is a Solution Right in Front of Us." This crisis didn't happen overnight. It was well underway when COVID-19 hit, and it won't go away when the pandemic ends. I'm furious that in the midst of this crisis, Ontario has thousands of IENs working as nannies, clerks, factory workers, and Uber drivers. As I mentioned, IENs, we mean internationally educated nurses. Birgit, there is a massive shortage of nurses in this province. The Ontario Nurses Association says 22,000, and that was before the pandemic started. Are you saying that internationally educated nurses are the solution here?
Yes, so internationally educated nurses are part of the solution to addressing the nursing shortage. Why do I say that? We have a lot of these nurses who are highly skilled professionals. They're qualified with lots of experience from different countries, their countries of origin, and some have actually worked in other, countries in the global north before coming here to Canada. So we have these nurses on ground. A lot of them have been trying for years to practice. They are part of the solution to addressing the nursing shortage. That being said, we have a poor working conditions right now. Nurses are quitting for a reason. So INs, yes, are a part of the solution. However, if those conditions don't improve, INs will eventually quit as well. So we need to address the root causes while incorporating and bringing INs to work with us to hopefully transition into more permanent solutions.
Now, Birgit, as we know, the province recently made a decision to deploy internationally educated nurses in hospitals. Do we have an idea of how many IENs are on the front line or on the sidelines waiting to get onto the front lines?
So in terms of data, honestly, it's really hard to get a hold of the exact number of INs that are waiting to transition. I know recently our Registered Nurses Association of Ontario made a reference to over 15,000 INs that are waiting to transition into the workforce. There's a lot of people that would actually help solve the crisis we are in right now. We have a lot of surgeries that are postponed, nurses that are breaking down just because of the shortage. So we really need accurate numbers to be able to address this, and actually to also see how many of these nurses, I mean, INs, have actually been able to transition. It's one thing to say, yes, there was an announcement made, but how many of these nurses have actually transitioned into practice? What I hear so far is there are actually INs that are still being deployed to workers, personal support workers. They've been DSkilled. That's the exact terminology. So to work in areas outside of their specialties, and I think that is a disservice to nurses right now that are waiting and hoping that there'll be solutions to address the nursing shortage.
I want to come to Amina. Before I ask you your question, congratulations. I understand you recently became a registered nurse here in Canada, but of course, this is not the first time you've practiced. I'm curious, what was your journey to be a nurse like?
Yeah, so it was a long journey to become registered in Canada, and I was fortunate that I was able to ingress in my PhD program here. So that made the process a little bit easier for me, not in terms of validation, because the validation is still pretty much the same process, but at least I had more job opportunities because once you came to Canada and you are a nurse, but you're not registered, that doesn't count as anything because nobody wants to hire a nurse who is not registered with their council. So I started my process in 2019 and I finished a week ago or 2 weeks
Oh, wow.
ago. So it was a long journey and frustrating with a lot of going back and forth with the council, trying to send documents and waiting for even a year to receive responses from them. So it was
That's
pretty much that.
quite a long time, 2 years. I'm going to jump to Carla. You're also an internationally educated nurse, but you've been working as a caregiver. Tell us a little bit more about your experience in trying to become a registered nurse here in Canada.
Well, I came here in 2018 to work as a caregiver, and I started my nursing application in 2019 and I finished it last year. In fact, I am both licensed as an RPN and an RN. While it's quite hard working full time as a caregiver, I did the examinations. I also did the language proficiency examinations, updated my safe practice. It was quite costly and it was quite hard because you have to balance your time between working and studying. And I was able to complete all of those last year. However, what's stopping me to practice is that I don't have the permanent residency application, permanent residency status, because my work permit is tied under the work permit of a caregiver. I am only allowed to work in the caregiving sector. So even if I am licensed, I cannot practice.
So that seems like a little bit of a trickier situation. Is there sort of a workaround in your situation with your permanent residence, or is it really waiting?
Right now, it's still waiting. I have submitted my application last year, and I haven't heard news yet. But the Registered Nurses Association of Ontario, led by Dr. Greenspan, is helping us. She was able to connect us with the immigration, and we are hoping for good news. I am a part of a group. It's not just me. I am a part of a group of 26 internationally educated nurses currently working as caregivers. And most of us are licensed, and we are just waiting for that one paper to start practicing.
What would it mean for you to finally get to practice nursing? You came here as a caregiver, but that wasn't really the goal.
Well, coming here as a caregiver is for us was the fastest way to get into Canada. So we are like, wait, we can just wait it now and hopefully transition to become nurses. So it's quite different. But then we just wanted to put in the work and hoping that we start working as nurses.
Birgit, I want to come to you. You're also a clinical practice instructor. Can you give us a little snapshot behind the scenes of what it takes to get those qualifications for an international educated nurse?
It is quite a very long road. I have taught in the International Educated Nursing Program, and where nurses just like Carla come in, and they have to go through the College of Nurses, and they go through a credentialing process where they're evaluated on whether or not they need to go back to take some courses to be able to practice. And prior to that, they also have to write the NCLEX. So it's a very long process. And unfortunately, for many of these nurses, the process is quite unclear and very, very costly because, mind you, these are mostly parents that also have families, and they have families here and families back home to take care of. So it's quite a challenging process for them. So imagine someone like Carla, who was a nurse back home, was gracious enough to become a caregiver. Not to take away from what caregivers do. Every role is important, but I think she put in so much work, time, and resources to become a nurse, and only to be DSkilled in order to qualify to come here, and now to go through so many hurdles for years. So these are the realities of the very many students that I've actually taught. I've taught students who have more experience than I am. I'm not even kidding. I've taught students who are like 20 years older than I am, students who've had like, years of service practicing as nurses back home in different countries with different specialties, highly skilled, mature. Like, these are the kinds of nurses we really need at the bedside. And I'm here teaching them, things they mostly already know, but they need to be able to just mark and check the papers. And obviously, yes, but we're not saying lower standards. We're just saying make the process more transparent, seamless for these nurses so they can come here. The goal is to have nurses at the bedside. And I think other countries are doing this. I know the US is, and especially during the pandemic, they were able to make the process less rigorous, less confusing. And I actually had students who were in my program, they quit in the middle of it, wrote their NCLEX with the US, and they moved there. And the UK is doing the same thing. So I think in Canada we have a long way to go. I don't understand the process myself, unfortunately. I can't tell you I do, and you can imagine the confusion amongst the students themselves. So yes, it's not clear.
I want to pick up on something you had mentioned. You had used the term DSkilled. What exactly do you mean by that?
Unfortunately, many times credentials from other countries that are, you know, let me say non-Canadian credentials are really looked down upon. This goes into, discriminatory practices and balls into colonialism and all that, and labeling, especially credentials from the global south as unfit or not enough, or people who are coming from educational backgrounds that don't have enough resources. So when they come here, they're overly scrutinized. And not to say that these people a lot of times are overqualified, and because I work with them. So it's not enough. Like I actually have a firsthand experience with these students. So they're eventually de-skilled, like Carla, who is a nurse, a registered nurse working as a caregiver. So let me ask every Canadian nurse out there how they will feel if they were to go to another country and be told that the only way they can transition to practice is to work in another area, like for example, as a personal support worker. How would it feel for you? And to bring your credential, your Canadian credential, which you believe right now is so valuable and so highly esteemed, and then they tell you that it's not enough because we have a process. Yes, we have standards, we have to meet those standards, high quality care and education. However, I think a lot of this has to do with discrimination.
Amina, I see your head. You're nodding a lot, so I can assume that you are agreeing with Birgit a lot on this. I'm curious, obviously, you and Carla have firsthand experience. What are some of the barriers faced by internationally educated nurses when they get here?
I think first of all is the lack of clarity in the process. Once you send your credentials to be evaluated and you receive the report and send that to CNO, the response you receive, they are not clear how to address those gaps. So for example, in my case, my biggest gap was the educational one because my education was not evaluated equivalent to the Canadian one. And now how do I do to fill those gaps? So they're not really clear limitations. They say it is your responsibility to find the program. And after you complete the program, they're going to evaluate if that is enough or not. So then I need to go there, find the program myself, complete the program, pay for that. So just after that, I can receive a response if that would be equivalent or not. And also another thing that I also think it is huge, it is the delays in the process. So as I said, I send different types of documentations to CNO to try to somehow address those gaps. And they had some response that took over a year to receive back. And then you receive those response and they did not accept that. So now you need to start everything from the scratch again. So I think it should be more clarity in the process for sure.
Carla, I want to get you in on this. It seems like you've done your due diligence. You've gone back, you've done all your tests, you've done everything. What are your thoughts in terms of the barriers there, for someone who's still waiting?
Well, the barriers, first and foremost, is it's very costly. For caregivers, there are 300 internationally educated nurses who are working as caregivers. So for them, some of them are helping out their families. So the salary that they receive should be divided between sending money to their families and also with the registration. So it's quite hard for them because every examination is expensive. You have to take the NCLEX, you have to take the IELTS, the documentations, you have to call your school for them to submit all the documentations needed by the assessment, the people assessing with the College of Nurses of Ontario. It's quite hard. Another is that like I said, it's you are working full time. Some of them are even working very long hours. They do not have enough time to study, so it's quite hard for people like me to balance the time between studying, between working on the documentation, between working as a caregiver.
I want to pull up a tweet that Birgit once tweeted. It's quite a powerful one, and it reads, "You know who isn't done with COVID? Nurses. We are tired of people who don't care about how their actions affect the vulnerable, immune compromised, disabled, and marginalized amongst us. We are tired of being called heroes. We are so tired of everyone who's done with COVID." Hero. It's a bit of a triggering word. Why?
Why do we have to be called heroes? If not that they've made the working conditions so bad and they're shocked that we're able to thrive despite the poor working conditions. And not only that, like the same government that calls us heroes has put in a legislation to cap our wages. Like, what a slap in the face. Like, with the one hand, you say, hey, heroes, and with the other hand, well, you can bargain your pay. No matter the increase in workload, I do not care. You know what? I'm going to keep providing you hospital beds. I'm going to keep, trying to find you, non-qualified, non-nursing staff to come and assist you, despite being short. So yes, every time I hear that word heroes, I am triggered, and not just me, my colleagues are too, because the working conditions are so bad. I can't even tell you. They're horrible, horrible for nurses, like scary for patients, totally scary for patients. And I'm talking about dangerous working conditions. And here we are being called heroes. What a joke. Like, change policies, like repeal B 124, the main reason nurses are quitting. Like, do something. Stop bringing us hospital beds when we don't have nurses to staff them. Like, I just don't want to hear that word heroes anymore, because we're not heroes. We're human beings. We're a lot of us are women. A lot of us are mothers going to work, trying to do our part in the best possible way. And we just need the resources to be able to work and save lives while not doing this at the expense of our own mental health. So enough of the hero calling.
Now, Amina, as we mentioned, you're now a registered nurse in Ontario. Do you have any concern going into the clinical settings at this moment during the pandemic?
Yes, I actually do, because I moved to Canada in 2017. So my last clinical job was in that year. So I just wonder, with all the shortage of nurses at hospital settings and any clinical settings are facing, how me, as being so for that long period of time away from clinical settings, will the team have time to train me so I can have all the needed skills to provide appropriate care for those patients? How is going to be returned to a practice as a registered nurse in the middle of a pandemic in a province where there is a huge shortage of nurses? So all of those things come to my mind as well. So it is a little bit of excitement of finally being able to work as an RN, but also a little bit afraid of how the clinical studies are and how it's going to be this adaptation process to going back to clinics.
And Carla, has the pandemic shaped your decision in pursuing nursing, or you're dead set on becoming a registered nurse here in Canada?
Well, my mind is set to helping. My mind is set to serving and contributing, I see stories like what Bridget said, that nurses are exhausted and they really need IENs right now. And I really want to help. I want to share my expertise. I want to share my knowledge. And seeing them really burned out, calling for help, here we are. There's a lot of IENs waiting to start practicing as nurses.
Birgit, I want to ask you a question. Obviously, there is enthusiasm, there is passion, there is the need to help, but I want to play devil's advocate just a little bit. We heard some anecdotes and stories of young nurses, students, graduates who just went in, and some who you've probably taught, who get into a setting and maybe feel alone, don't have the supervisors, don't have the nurses that normally would be there to help them through some of that stuff. Is there fear that IENs would find themselves in a similar situation? Obviously, many have years of training, but there might be a bit of a learning curve. Is that going to add perhaps chaos to the crisis that's already there?
Well, I'd like to think that is not going to add chaos, but it is true that a lot of nurses are worried that they don't have enough time to even care for the patient, let alone to train, nursing students or help INs transitions. But that being said, that doesn't mean that there are not individual nurses out there that are waiting with open arms to support you and to help you transition into your role as a nurse. And but it is difficult. These are difficult times. These times are actually unprecedented, like we've heard so many times. A lot, and why it's so difficult is because a lot of experienced nurses have actually left the bedside. So we have mostly new hires, new grads, training new new hires, new grads, and which is a challenge, right? There's nursing is a practice-based profession, so experience comes with practicing. So when experienced nurses are gone, so the newer nurses are they have limited experience as well to share with you. So we're hopeful that more experienced nurses do not leave, especially with hopefully I'm quite hopeful that tomorrow's meeting with Premier Ford will definitely lead to a repeal of Bill 124, which is I really really am hopeful for. Otherwise, that meeting to me is will be completely useless. And the fact that I remember when this announcement was made that INs will be able to transition into practicing right now. Some nurses expressed their fears as to how is this going to look like, and some discriminatory fears that language barrier and all that. So I think it's very important that nurses keep their minds open, and those biases about INs or a lot of these nurses not knowing how to communicate in proper English should really end, because these are all rooted in racist beliefs. These people well educated, they go through such rigorous training and transitioning to be able to come here. So I want nurses to open up their hearts, their minds to support INs, because these are knowledgeable, highly skilled individuals that definitely know how to communicate and know how to critically think. Like the fact that someone knows English, is born into an English speaking country, doesn't guarantee critical thinking. So I think people need to open their minds to receive other people that speak differently, that don't have the same, intonation as like they do, so we can all move together towards working as one profession. I really do hope that Bill 124 is repealed. Otherwise, even INs will burn out.
I want to actually pick up on Bill 124. You touched on a little bit about wage, but what else is holding nurses back? Why are they leaving because of Bill 124?
Well, our workload has increased in the past almost 3 years now since the pandemic. I remember, working in an ICU with 22 patients and having 20 nurses on a shift, 21. Sometimes, it's so bad we have 18. But these days, having 12 ICU nurses for 22 patients is the norm. So that means that every nurse has two critically ill patients, and the normal ratio is 1 to 1. increased workloads. We're running in and out of these rooms. And don't forget, we're always in full PPE when we provide care. We wear N95 masks throughout our shifts. I'm talking about 12 hours shifts, 16-hour shifts. Sometimes people are being asked to stay for 20 hours. So our workload has quadrupled. You go home exhausted. I had to reduce my work hours. I'm mostly home these days because when I just think about the working conditions, I'm like, another day off. Like, it's just too much to handle. So our workload has increased and we're not able to bargain thanks to Premier Ford, who implemented Bill 124 as soon as he got into office to cap our wages at 1% increase a year. We've all heard what inflation is like these days. So nurses are not able to afford childcare. Nurses are not able to afford houses. We know almost nobody can buy a house right now, and nurses are leaving because the workload is too much, and there's absolutely no support. Even managers are leaving, let alone nurses. The work hours are inflexible. People, like I said before, a lot of nurses are women with children, with schools going on and off, online and in person. Nurses have had to take time off to stay with children. Childcare is very expensive if you have to go to work, and Ontario is still the only province in all of Canada that hasn't signed the $10 a day childcare deal. So there are a lot of inequitable policies working against nurses in particular because we're a female dominated profession. So there's so many reasons, but Bill 124 is a major reason. Inflexible work hours, lack of support, sometimes from depending on where you work. That's also a major factor, and people are just tired, and the toll on the mental health is it's completely unbearable. I haven't seen these many deaths in my entire career, and it's a lot.
We are going to have to leave it there. I want to thank you all for joining us tonight on the program. Some very important stuff, some very impactful stuff. And of course, Carla, we wish you all the best as well in your journey.
Thank you.
And thank you so much.
Thank you so much.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.